Today I'm joined by Bob McDonald, Executive Director of the Denver Public Health and Environment. Our goal of moving from rescue to recovery took a significant step forward last week when Denver moved to level yellow on the state's updated COVID dial. This good news reflects the commitment of our residents to slow the spread of the virus by wearing masks, washing hands, and following public health guidance. Now, we're not out of the woods yet, and we can't let our guard down, but we have reason to be optimistic, and the more we can get our residents vaccinated, the better our path to recovery, not just for public health, but for our economy. I want to provide a brief update on our vaccine distribution planning efforts. Currently, we're about 12% of our residents ages 16 and over having received their first dose of vaccine, and about 6% of our residents having received their second dose. And I'm encouraged to hear the news that the Biden administration will release an additional 27,000 vaccine doses to Colorado on top of the original amount over the next few weeks. Now, we're grinding yard by yard toward that goal line, and my administration and I remain focused on helping to get some of those doses into communities that are being impacted the most and where access is limited. To address that, we will be partnering with Denver Health to open 4 community vaccination sites to help get shots in the arms of our residents who are eligible to receive them. Now, the first of those sites will open in Montbello next Thursday, February 18th, with the other 3 locations in Northeast, West, and Southwest Denver coming online soon thereafter. We're also going to keep our focus on getting vaccinations into the arms of our unhoused neighbors. The more people we can get vaccinated, the better. So it makes sense to prioritize the most vulnerable among us. That equity focus is going to continue to guide Denver's efforts, and we're not going to divert from that. Now, Bob McDonald, when he comes up, will talk more about the event next week in Montbello and how we're going to proceed. But the recent effort put in by our residents to bring our numbers down helped us get to the place where we could implement our 5-star program and certify businesses that have gone the extra mile to earn increased capacity. I want to congratulate and thank those businesses that participated. This is critical. And I know the move to level yellow shortly after we got the green light to certify 5-star businesses was frustrating for some, but our program is still a critical tool to help businesses open up more in the weeks ahead. And with that said, I want to encourage folks to implement those additional safety measures and get certified for the program. That certification signals to the community that you are going above and beyond to keep staff and customers safe, the gold standard, and gives them the peace of mind. It also means that once we get 70% of Coloradoans age 70 and above vaccinated, which should be in just a few weeks, your business will be among the first to open with level blue capacity. And to me, that is another tremendous sign that our economy and our efforts are working. Finally, I'm going to wrap up my comments today by highlighting a situation we're currently in. And this is very important. I've been focused on this now for a couple months, but most recently we've accelerated our efforts. We've been awaiting tens of millions of dollars in reimbursement funding from FEMA for costs incurred responding to the pandemic over the past 11 months. Our Region 8 FEMA office has been a great partner throughout this response, and we're continuing to work with them to help move this along. I want to personally thank them for the increased attention they put on Denver's reimbursement claims. We know the hand that FEMA was dealt under the previous administration, and we're encouraged by what the Biden administration has done since taking over things. We recognize that things are on a better track right now, but it's vital that FEMA move as quickly as possible to work with Denver and other cities, because we know that we're not the only city facing these challenges right now. I'm in regular communication with mayors all over this country, and there are some cities like Denver who are on the financial edge trying to figure out how we're going to continue to address the needs of the challenges presented by COVID and continue to provide core services to the people that call our city home while waiting for FEMA to finally reimburse us. This has been too slow and too long. Now, I was on a call yesterday with Vice President Kamala Harris and another call with our new Secretary of Transportation just last week. And I joined with other mayors recently in a letter from the U.S. Conference of Mayors asking for help to break the FEMA logjam. It's really, again, I'm going to say this again, it's been really refreshing to know the Biden administration is listening to mayors when it comes to the need for financial support, for direct funding, and the need for more vaccines coming directly to cities. And I continue to stress all those points with the Vice President and the Secretary when we spoke last week. With that, I'm going to turn it over to Bob for an update on our current metrics and vaccination efforts. Bob?
Thank you, Mayor. I want to thank everyone who's able to join us this afternoon. Before I jump into the slide deck, I just want to start with a couple of opening remarks here, and then we'll take a look at some data and open it up for questions. I want to start off by saying I feel very good with where we are. I remember last year and even a few months ago, every time we'd give an update, I recall saying that if we stick together, we're going to get through this. We're going to get through this. I feel comfortable saying now we are getting through this. We are seeing numbers going down across the country. There are still some states that have some very high numbers, still struggling with managing the pandemic. But here in Denver, our numbers are looking very good. And it's because of everything that every citizen is doing, every business owner is doing, complying with those public health orders. That is helping us get where we need to be. Let's take a look at some of the data and what we see happening across the country. You might recall a couple of months ago that even 3 or 4 weeks ago, this map that you see now was very dark red, including the state of Colorado and here in Denver. The pandemic was out of control. Now we're seeing states go to a brighter or a lighter color of red, if you will, and even to that phase that where it's considered to be under control or managed a little bit better. We still have a long way to go. Now I'm asked though, why is this occurring? Is this because of vaccination efforts? Is it because of herd immunity? Is it because of compliance with public health orders? It's all of those things. We are not at herd immunity yet. We got a long ways to go with that, with having many more people getting vaccinated. But all of these things are contributing to getting these numbers down across the country and certainly here in Denver. So compliance is still very, very important with public health orders. And I will say probably the last thing to go as we pull out of this pandemic is lifting the face covering order. This continues to be probably one of the most important public health controls until we reach that point where we can all take these off together and celebrate. So let's take a look a little closer to home here. You can see the epi curve here in the city of Denver and that last spike at 728 as a cumulative case rate. The state recently moved to monitoring this on a 2-week basis to a 7-day basis, so that you'll see the numbers are a little bit different than what we've been referencing in previous updates. And I agree with that. Moving from a 14-day to a 7-day, the more granular the data, the closer we look at that, the more quickly we can respond to what's occurring. You can see now we're down to 137 for a 7-day cumulative case rate per 100,000 people here in Denver. Very close to that yellow category and soon to the blue level if numbers keep trending the way they are. We are seeing the greatest drop right now than perhaps any time during the pandemic. When you look at this next slide here, you'll see again a summary of where we are in the state style with our 1-week cumulative case rate. Positivity rate continues to drop. I get a lot of questions about that. Well, is positivity going down and case rates, are they going down because less people are getting tested? I would be concerned about that if positivity was staying up. If less people were getting tested but positivity rate was still very high, I think we'd be concerned about the less testing impacting our case rates. But still, we have many opportunities for people to get tested throughout the city, and we encourage that to keep doing that as we move through the pandemic. And you can see that hospitals are still very stable. ICU capacity is going up more and more. And with the next slide here. So recent changes to the state style. Again, I'm completely supportive of this. Looking at 7-day averages instead of 14-day averages gives us an opportunity to respond quicker. And we know more now than we did at the beginning of the pandemic. We know that a case rate of 350 or a case rate of 300 doesn't necessarily threaten our hospital system. And so finding that balance between public health and protecting our residents, protecting our hospital systems, and protecting our businesses and and just all those things that we have to contend with, but with public health controls. Knowing more now, it makes sense to raise those capacity limits every step of the way. Having said that, one of the things that we've done from the beginning, and we're going to continue to do this, we're going to be driven by data. So regardless of the variants that we are seeing across the country, across the world, regardless of the 5-star program, we're going to be data-driven. If data goes up, if cases go up, we're going to respond quickly. Next slide, please. You can see here in Denver, we are in yellow. We still have a number of communities that are still struggling with their case management, with their case rates, but we're trending down, and again, compliance with public health orders is key to keeping that trend in the direction that we want to see. Next slide, please. We've got a lot more work to do with vaccination rates. The limiting factor here, and I want to be clear on this, the limiting factor in Denver is the amount of vaccine that we receive. That's largely out of our control. The mayor's taken action on that. We've communicated the need for more vaccine, much more than we're receiving now. You can see that we're about 10% of Denver's population that have been vaccinated. So again, that contributes to somewhat to the reduced spread, but we have much more work to do. I get a lot of questions about pop-up sites versus static sites and vaccination outreach teams. There's a lot of great work going on out where we've seen some of our healthcare providers do large drive-through sites and other partners doing pop-up sites. All great work, but the city is focused on having a city-wide, equity-based vaccination distribution plan that is sustainable. That takes a little bit more time to coordinate, but we are getting there. Next slide, please. The tiers have been adjusted by the state health department. We are required to adhere to those phases. You can see here that phase 1, 1A, 1B, B2, B3 is getting rather large, but we're going to manage that. But we have to stick to these tiers. Right now, we are in 1B1 and 1B2. It's going to be another month or two before we get to 1B3, but I want to stress this too. If somebody is in a 1A category and did not get vaccinated, that does not mean that your time has passed. It means we're moving on to opening up the opportunity for further tiers to come in and get vaccinated. But those who have not been vaccinated in 1A and now choose to do that, please get your vaccination. Next slide, please. You know, from the beginning of the pandemic, our focus has been equity-based, getting into communities where we can reach our most vulnerable populations with static sites, places that they can count on that will be there 7 days a week. That's the model that we're moving towards with vaccination. Our entire vaccination operation is being managed out of the Emergency Operations Center with an equity focus. And we are moving towards setting up vaccination sites in our most static, vaccination sites in our most underserved communities, locations that people feel comfortable going to, that are going to be there every day, making sure that people can get shots in their arms. Next slide, please. A number of ways that people can stay updated. There's the hotline here if you want to call in and get the most current updates. This is managed by the state of Colorado. If you want to register locally for ways in which you can be updated, you can take a look at the next slide here. Go ahead and text COVID to this number here. Text COVID to 336-837. Okay? You'll get a text message back that says, are you sure you want to do this? Or you're confirming that you want to receive a weekly update about what's occurring. This is not a mechanism to get registered. This is a mechanism to stay updated on what's occurring throughout the vaccination phase. So again, you'll get a text message every week. You can use that hotline, and you can certainly reach out to 311 and be connected with the right agency on whatever questions you might have related to this effort. Until then, we are getting there. We are getting through this. Keep wearing those face coverings, keep washing hands. Those things are working, and that's going to carry us through the end of this. And with that, I'll turn it back over to the mayor.
Thank you, Bob. And I want to make sure that we thank all of our public health workers, certainly here in the city and county of Denver under Bob's leadership, tremendous leader, but also throughout the state of Colorado, folks who have stood in the gap and really worked to interpret and to help make all that we've been through over the last 12 months understandable, but also accessible in terms of information to the people we all represent. Bob's been a tremendous advisor along with his team as we've worked our way through this very challenging journey. Teresa, let's go to Q&A.
Call on you, those of you who registered with us at the top of this press conference. So I will start with Esteban. Do you have any questions?
Sure. Hi, Mayor. Can you talk a little bit more about the community vaccination site opening in Montbello? How will people be able to sign up? Who's eligible to get vaccination? And is this a similar situation where the city's working with Denver Health to provide the vaccines?
Yeah, I'll let Bob come forward, but we are working with Denver Health as our partner on this. And before I turn to Bob, let me just underscore what Bob made mention of that is important to us. One, these helping us get to our communities that are perennially overlooked and typically are most challenged and have been most challenged during this COVID pandemic. Setting up static or permanent sites is going to be critically important to us, where residents can predict and can expect that these sites are there for themselves as we get through the various levels of vaccination. And so this is critical for us to continue to reach those who are in 1A, and 1B, and 1B2 as we go forward. Bob, you want to continue to talk about how folks can access this registration?
Yeah, well, I think the mayor covered it very well. I mean, it opens next week, and that was very deliberate. One of the things that we did very early on, and I will remind everyone that we have, I think, 70 or so locations across the city of Denver that are registered as vaccine providers. Now, many of those are pharmacies embedded into grocery stores. We intentionally mapped that so that we could see where the gaps are, because we know where there are not grocery stores, there are not pharmacies, right? So we did that with the purpose of identifying those locations where we needed to set up these static sites. This will be set up next week. Those that fall within the tiers that we discussed earlier will be able to register. One of the things that is being discussed is how do we make that as easy as possible. We recognize that some don't have the wherewithal or the tools needed to register as easily as others. Those are all the details that are being worked through, and we'll be pushing out information the closer we get to the opening of that site.
Next.
All right, Hannah from the Gazette. Do you have any questions?
Hi, could you talk a little bit more about can you talk a little bit more about how you're going to be prioritizing homeless residents in the vaccine rollout?
Well, we have obviously submitted a request to the state, and that was, we were not allowed to do that at this point in time. We continue to follow and work with the state, follow the guidelines. The hope is that as we continue to appeal to the federal level, at the federal level, that we'll receive direct distribution of vaccinations. And if we are able to do that, then we'll use those vaccines to be a little more nimble in terms of the demographics of people that you might be more aware of, we are more aware of here at the local level as opposed to working from the state level. So our goal in recognizing, particularly, right now is a perfect example, as cold as it's getting, we got a pretty nice cold wave coming through, the Canadian cold wave, I like to call it, coming through here. A lot of residents who are unsheltered are still concerned about going indoors to shelters, even though we believe they're safe because of the COVID virus. We believe that we should be able to vaccinate them, as well as the workers who work with them on a very regular basis, the service workers, and to make sure that everyone is safe in that environment so people can feel confident going indoors during inclement weather, certainly during these times. So we're going to keep pushing on that. We're continuing to talk, as I've shared with you. I spoke on the federal level to the Vice President and to the Secretary of Transportation recently about it, and we'll continue to make that appeal to get direct distribution to the cities. I think that's the best and quickest way for us to get that objective accomplished.
All right, Shelley from the Post.
Yeah,
let me add one other
on
place.
The financial edge.
Shelley, one second.
And I wonder if you could give an idea of what happened.
Go ahead.
Yes?
No, I was just there's one point that just came to mind. Obviously, some of our neighbors who are unsheltered in the city fall within the categories that are eligible today for vaccination. And we want to, as many of us are outreaching to them on a regular basis, we're encouraging them to get into these clinics and maybe come through some of the sites that we are setting up to get them vaccinated. So we are very active. We also have mobile units that are going to be moving around to do that as well. So as they meet the eligibility, we're going to get them vaccinated. I'm sorry, go ahead.
Go ahead, Shelley.
Okay, I am just wondering what happens if the FEMA reimbursement money continues to be delayed? What are the consequences for the city?
They're severe. I mean, right now we are, of course, meeting the challenge of the COVID pandemic while also continuing to deliver our services. We could have further service cuts, quite frankly, if we're unable to get reimbursed. We're talking about no small number, $61 million that is owed to the city of Denver. And so we're working as furiously as we can. I know our finance people are working on it, continuing to work with the FEMA Region 8 office, which has been wonderful to work with to reconcile and to get these dollars back to Denver. What it's doing today is it's holding up a lot of things that we need to do under our CARES Act. Further efforts we need to make or take to further help our residents as we face this pandemic. We can't do a lot of those things while those dollars are still pending out there. It's a pretty sticky wicket when it comes to the financial challenges that we face. So we got to be smart, and if we don't get it soon, it could be even further cuts in services that we offer to the people.
Thanks, Shelley. Let's go to Vinny Bloomberg.
Thank you, Teresa. Hello, Mayor. This is Vinny Belchudes at Bloomberg. On COVID, could you expand on the call with Vice President Harris and other administration officials on the federal response now? What progress have you seen since the Biden-Harris inauguration? And do you have any criticism of the Trump administration's COVID response now that you've had some time to dwell on it? Thank you very much, sir.
I'm sorry to laugh about the question around the Trump administration. Listen, we've had some great. We've had some great conversations with the Biden-Harris administration since day one. As a matter of fact, even before they took office, I participated in maybe 2 town hall meetings with other mayors around the COVID response and development of the American response bill that they have in front of Congress today. So it's been phenomenal. Access has been amazing. I've had at least 3 calls with mayors and Secretary of Transportation, Secretary Pete, about the plans moving forward with transportation infrastructure investment. It's been phenomenal. We're working very closely with Secretary Pete. We expect to do that with other secretaries as they get settled in and move forward. Yesterday with Vice President Kamala Harris, it was with the African American Mayors Association. And we had a very detailed conversation about COVID response, about the American Relief Bill, and about some of these issues such as the FEMA reimbursement challenges that we're facing, direct vaccine distribution to cities and counties, about how we can be helpful as mayors in helping to shepherd the American Relief Bill through Congress, and conversation with our delegation members, and all those are staying focused there. So it was 45 minutes that went very quickly. But I had a chance to directly address the vice president. I was one of the mayors that was allowed to ask a question, and I directly talked to her about FEMA, and I gave examples, but also about direct distribution to cities and why we believe cities are more nimble and able to reach various demographics that maybe are not on the radar in the state, not intentionally, but because we're on the ground and closer to the people, we're aware of the challenges that many of the residents are facing in our cities. And our homeless population is one of them. And if we had direct allocation of vaccines as a city, more control of our ability to be nimble, we can move it to our neighborhoods that don't have health institutions readily available or accessible to them, or maybe are sitting in food deserts and don't have grocery stores or pharmacies readily accessible to them. We know those things. We know them almost instinctively because we're working in those areas on a regular basis to attract those opportunities. And she and the other members of the administration who were on that call understood exactly what my anecdotes I was trying to describe through my anecdotes. They got it. And we'll do some follow-up with them from this point forward on those issues.
Thank you, Vinny. Let's go to Gabrielle from Fox.
Thank you. Hey, Mayor, one of my questions was pretty similar to Shelley's, but just to follow up, how much money are we exactly looking to get back from FEMA? And then a second question, under the new federal allotment, will the city still get doses from the state, or will it be directly from the federal government when it comes to the vaccine?
Yeah, I'll let Bob answer your second question, Gabrielle, but we have a $61 million reimbursement tab in front of FEMA at this point in time. So it's no small number. Bob?
So, yeah, we anticipate that we'll continue to get an allotment from the state. I expect that that will continue through the pandemic. What we're hoping for, again, is more direct allocation to local public health municipalities so that we can manage that. But my expectation is, or my anticipation is that we're going to see both throughout the pandemic.
And let me just add the additional 27 million doses that have been 27,000 coming to the state per the Biden administration. That will be on top of what we already receive. And so that will be helpful. We're also optimistic because we may have another, as you know, Johnson & Johnson has applied for approval. So we may have another 2 vaccines coming on the market relatively soon, and that will be helpful. There's reason for us all to be optimistic in terms of accessibility. I will just say again, direct allocation to cities in addition to what the state is doing will be helpful because it allow us to be more nimble.
We have time for about 2 more questions. Are there other journalists on the line, and could you identify who you're with and your question, please?
Is that it?
Any additional
Hi, this
questions?
is Jacqueline from CBS Denver. Are you guys able to hear me? Is that okay?
Yes, Jacqueline.
Okay, so I was just wondering more about this community model, right? Is this going to be something that we're going to use for, the future of vaccinations, talking about how to get to underserved communities? Because I was wondering, how does this work in relationship to allocation? Because every single time we want to have these efforts, it's up to how many vaccines we're getting. So how does that all work?
Well, certainly to do any of this work, you have to have an adequate supply of vaccine, which we do not have right now. I'm hopeful that as we get more and more, all of the sites that in the model that we're building out will be supplied and well supplied so that anybody can go anywhere, what's most convenient for them to get vaccinated. That will include, through our vaccination outreach teams, the static sites that we're setting up to address equity gaps, local pharmacies. It's hard to say what does the long-term model look like in terms of how this plays out. I think it's largely dependent, again, on how much vaccine we get. If it's minimal, if it's far short of what we need, which is what we've been receiving, far short of what we need, we have to be very thoughtful with how we allocate those. So it's hard to say over time, but our hope is that we have this just vast network of pharmacies, static sites, working with healthcare partners, clinics, hospital settings, so that people can go where they feel most comfortable with ease to get this done and to get it done as soon as possible.
Jacqueline, thanks. We have time for one more quick question, please. One more quick question.
So, where they feel comfortable with ease to get this done and to get it done.
I'm hearing feedback, so I don't know if you could mute your phones, please.
So I just had a quick follow-up to that, which is what can people do to suggest ideas, or, if they need help in their particular community, who are they reaching out to? How do they go about doing that?
Yeah, so again, on the slides there were a couple of things that people can do. They can call that hotline. They can register with the City of Denver to get text messages. They can call 311 if they want to connect with my department or other departments on where they can get information. There is a great deal of information on the city's website. So please reach out with questions. I would encourage everybody to sign up with those with that text messaging effort there. A lot of information will be pushed out through that as well. Number of ways that people can stay up to date.
As we wrap up, let me encourage folks, if you know an older adult in your family or on your block, in your church, please reach out to them. I'm a deacon in my church, and I got to tell you, I've received calls at home from members of our church, older adults who have been challenged by the process and wanting to know how they get vaccinations. And some of us are at a place or age in our lives where we take for granted access to technology, and we have our smartphones and computers. A lot of our older adult family members and neighbors don't use that technology. And so we can't take for granted. They see on the news people getting shots and they don't know where to turn to even begin. So Bob has laid out for you, some options. If you know of someone, please take the time to ask them, have you been vaccinated? Do you know how to get registered or how to get started to find out how you get the vaccine? And if not, help them. 311 or texting COVID to 336-837 is an option as well. And of course, the state has its website. But please take the time to maybe help an older adult. The sooner we can make sure that our 60 and older, 70 and older residents, neighbors, friends, family members are vaccinated, we can get to the general public and again move everyone to a place of health and more freedom under this pandemic, as well as to revive our economy. And so we can all do this together, and we must do it together in order to get through it properly and efficiently. We're doing well, but we can do much better, and we can do it together. So thank you all for joining us. Have a great day. We'll see you next week.